Dishman. So, to begin, you see a crisis on the horizon. Tell us a little bit about it.
I can start with a poll. So raise your hand if you are currently involved or have done caregiving for a family member. Lots of hands going up there. And time is going to show even more. The way I look at it is, if you look globally, there were about 3,000 people on the planet in the year 1950 that were age 100 or more. In 2050, 100 years later, we're anticipating having 6 million. That's people 100 years or older. Right? So we have this kind of success catastrophe in our society where we've increased longevity, and we've done these miraculous medical technologies and breakthroughs in antibiotics and farming and agriculture that are keeping people alive for a lot longer. But I think about Spock from Star Trek. It's live long and prosper. So it's not just about longevity, it's about quality of life. And how are we going to use innovative technologies to help people age in place so that they have a high quality of life even as they're sort of living longer. And the challenge on this is really the cost of healthcare. I mean, the US is in the middle of this health reform quagmire. 22 other countries that we track at Intel have passed health reform in the last year and a half. And it's all driven by global aging. I mean, these stats here showed 2002, the number of people over the age of 60. In a 50-year period, we double and then double and again the number of people over the age 60, who are the lion's share of healthcare costs. We're already broke on healthcare. We're already spending too much of GDP on healthcare. That's before we double the number of the typically sickest and oldest people coming forward. So we've got an enormous society challenge. I often say this is global aging is the other inconvenient truth. Right? We all know what global warming is. We're all thinking about how Portland as a city, how Oregon as a state can be at the forefront of green technologies for global warming. Well, I want to ask, what are gray technologies, if you will, to help us prepare for global aging? Because it's every bit as big of a challenge to our society. It's basically a little wireless computer. This particular version, I've got multiple ones. This one has accelerometers in it. This one is a galvanic skin, same base platform, and so it measures stress. This can become a 3-lead ECG for measuring stress and heart rate variability when you wear wireless leads. And we built this one, and we put it into the socks or into the pockets of older people who are at risk for falls. And the state of understanding falls for older people, which cost billions and billions of dollars each year, is surveys that would come in. My wife's here, her grandmother-in-law passed, or my grandmother-in-law, her grandmother passed away from a fall. And 6 months after she had died from it, the state sends her a survey that says, what were you doing when you fell? That was our understanding of what was going on with the human body. So this little tiny computer, which can be much smaller if we want it to be, we really collected in Portland and in Ireland a cohort of about 1,000 seniors over a period of time, so we can figure out what are the behavioral signatures. If I hooked it up, you could see in the software it's measuring my heel-to-toe strike, it's measuring how fast I'm walking down the hallway each morning relative to my own speed the previous days, and if I stand in place, it'll measure the amount of postural sway back and forth. You and I have almost a signature, like a thumbprint postural sway that's unique to you and unique to me. But what's important is this can pick up subtle changes in your sway or my sway over a period of time that show that you're becoming at risk for a fall. So we think, over time, maybe even 75% of falls, which are just classic in terms of hip fracture and death and enormous expense to society and enormous suffering, we think 3/4 of those could be gotten rid of by detecting there's a problem well before it occurs. But again, that innovation mindset is we'll spend billions of dollars as a society to build the next MRI equipment in the hospital to maybe get slightly better resolution on your hip fracture once you've already had it, but we won't spend hundreds of thousands of dollars on R&D in universities to prevent the hip fracture in the first place. And that's the mindset that we've got to change.
So, some people might find this a little creepy.
Yeah.
Yeah, in terms of the monitoring. What is your argument against that? I mean, is it just purely a cost-benefit analysis, or how would you frame it to somebody who's like, I don't know, I would really want to...
The people who bring up the big brother argument are usually the family members of the people who actually need the technologies. And if you talk to the people who actually need them, they're like, first of all, make the data private and secure. And privacy and security is very unique to the family, right? We'll come into family A, and the elder there doesn't want to share any data with anybody. In family B, they want your daughter to have this information, their doctor to have this information, and their neighbor to have this. And in family C, it's different. So for one thing, privacy and security is important, but it's unique, and you need to make choices so that individuals and families can decide what they want to do. But what I would say is more often than not, it's the veteran coming back from Afghanistan or veterans from World War I and World War II that are saying, look, the alternatives you're not faced with. You're young, you're healthy, you still think you're immortal. I'm having to move out of my house of 35 years or give up my career or fill in the blank if I don't have something that's going to help me maintain my activities of daily living and what I want to do. Let me make that choice. So I often am like, when families will come to me and say, my mom can't do this or my dad doesn't want to do this, I'm like, no, you think that about your mom or your dad, but we've trained 90-year-olds who had never used PCs in their life and have early stage Alzheimer's how to use it, and they've gotten real value from it. And we've actually never found a case where, in all the pilots and things we've done of research and products, where once people understood the value proposition for it, if you secured the data and made it easy to use, that they didn't go, oh my God, I can't go back, right? I have to have this innovation in my life.
So somebody has to be at the other end, basically receiving this information, diagnosing, being available for these people to talk to them, whether it's electronically or by phone or whatever the interfaces that you want to create. Tell me what you think the healthcare field will look like in terms of personnel. Will we see a change in the number of nurses and doctors or in other kinds of trained professionals? What do you imagine these devices will create, say 5, 10 years down the road?
Well, I mean, it's interesting. If you look now, in the United States, there are 200,000 healthcare job openings in the United States right now, right? You'd think there's no job openings given the discussions that we're having on. The reality is we don't have the educational infrastructure in place to create enough doctors and nurses, particularly in primary care and geriatric care, to catch up with that age wave or that global aging that we talked about at the beginning. There is no way that we're going to mint enough new med students and nurse students to catch up with global aging. The reality of it is that people who are going to be doing the care are we patients ourselves and we family members. And part of the drive here is to say, look, today, AARP calculated that we all give about $275 billion worth of free care a year. In other words, if all the care that we're doing had to pay for, that's what it would cost to actually get it. But we do all this with no training, no technology, nothing to help you all do the second full-time job of caring for a loved one. So the key is, yes, make as many doctors and nurses as you can, incentivize education, but you're not going to catch up. You're going to build self-care technologies while we help to care for ourselves, and you're going to build family caregiving technologies. And the role of the doctor and the nurse is going to be a quarterback of a team of people who are helping to manage your care. And you're on that team, and your family members or neighbors or friends, whoever part of you, are on that team. And the quality of that care is being tracked. People are being rewarded and reimbursed, even in some cases the family members and volunteers. That's a paradigm that we're going to have to create. And we're far from that right now because we have, see a specialist, see a specialist, see a specialist. And that sort of specialist mentality is part of what's gotten us into this trouble. We have a health reform bill in all these countries that basically try to reintegrate care and do some common sense care again that says teams of specialists and a primary care doc and the person and their family need to coordinate care together. And a lot of the technology here today can actually help us do that.